thank you very much. Good afternoon, everyone, and thank you for taking time to join us here today at the mass vaccination clinic at the International Trade Centre at Evraz Place in Regina, and we're very fortunate to have a facility like this in Regina to be able to convert it to a mass vaccination facility like we have here today. Minister Merriman and I were just given a very good tour by Laveena Tratch, and thank you, Laveena, for the tour. Laveena is the COVID immunization chief for the Regina Incident Command, and if there's any questions with respect to the facility, I would invite Laveena to talk about the facility that they have set up here for vaccinations in Regina. We also had on a tour Dr. Tania Diener, the physician leading the vaccine planning for the Saskatchewan Health Authority, and if there's any clinical questions, I would ask Dr. Diener to weigh in on those. And as well, we had Sheila Anderson, the vaccine chief for the Saskatchewan Health Authority's Emergency Operations Centre, the operations of ultimately this facility here in Regina. So I want to thank each of you for showing us around and the lovely tour that we had of the facility that I'm sure is going to prove to be a very effective facility in the weeks and the months ahead in providing a number of vaccines to people in and around the Regina area. Thank you for the effort and the work that you've done in getting this facility functional. We looked at 3 different kinds of immunization sites here today at the International Trade Centre. There's the mass immunization site where we are located here at the moment. There's the drive-through immunization site and a mobile immunization vehicle that will be available to head out to people that may not be able to travel to this facility. Mass immunization sites, just like this one, will be our main venue for vaccine delivery in our major populated areas in the province, and you will be able to make an appointment either online or by telephone. Then you can show up about 5 minutes prior to your appointment time. That will give you time to get registered. Then wait for the next available immunizer, which are at the tables behind us. And when the station does open up, you go and you get your shot. Then you wait about 15 to 20 minutes to ensure that there are no adverse reactions to the vaccination. And that is the very same way that we wait a couple of minutes after our flu shot to ensure there's no adverse reactions to that vaccination. You then will get a card showing you the type and the date of your vaccination, and when your time is up, you are free to leave. We'll have about 30 physically distanced immunization stations. We have about 10 in this room here that we're in here now, and it will be completely scalable so that we will be able to open up to whatever number of stations we need to administer the amount of vaccines that we have on hand at any particular time. Each station that we see will have the ability to vaccinate 6 or 7 people per hour. So if we have all 30 stations operating, that's about 180 to 210 individuals that will be able to go through these stations just at this one particular site. When it's your turn, you can also get vaccinated without an appointment by going through the drive-through site. These are just handled in the very same manner as our drive-through clinics, testing clinics, and these drive-through clinics will be on a first-come, first-served basis, much like, as I said, the testing sites that are currently operating. This location will be able to accommodate up to about 18 vehicles at one time for vaccinations. That's on top of the drive-through testing capacity and the drive-through testing sites, which will continue to operate while we are operating the drive-through vaccination site. Because the drive-through is not by appointment, we don't know how many people could show up at any particular time, and there may be more than one person in each vehicle, like there is with the testing sites. So the wait times may be a little bit hard to predict with the drive-through sites, but we will be moving people through as quickly as possible, and there is a significant amount of capacity there to move people through. So this is definitely a good option for everyone. If you don't mind, at times there might be just a short wait. We'll also have a number of mobile immunization vehicles throughout the province, and we had the opportunity to see one here today. We recognize that there will be some people that may have difficulty getting to a vaccination clinic, getting to a mass vaccination site like this one, due to maybe mobility or even affordability. So if you can't come to the vaccination clinic is ready to come to you. Each of these vehicles will be a self-contained immunization clinic with all of the supplies and resources needed to vaccinate groups of various sizes. These could be, for example, in rural communities, in congregant or assisted living homes, First Nations or Indigenous communities, urban Indigenous communities that we have, and those are just a few examples of where we could use the mobile immunization vehicles. So there are 3 types of vaccination clinics that we have on display here today. In addition to that, there will also be vaccines that will be administered at public health offices, at pharmacies across the province, physicians' offices throughout the province. So there are many, many options for Saskatchewan people to access a vaccine and to get vaccinated very quickly when it is their turn. What we need now are a few more vaccines here in the province. Just this morning, the federal government has said that vaccine deliveries will again be ramping up. Today, Major General Fortin said that Canada will receive 23 million doses between April and June, essentially Q2 of the year. Saskatchewan's share of the 23 million doses would be about 700,000 doses. That would equate through that same time period to about 8,000 doses per day. When that happens, as you can see here today, Saskatchewan will be ready to deliver those doses. In the meantime, we all need to continue doing what we're doing. We need to be careful, and we need to continue to follow the public health guidelines and the public health advice that we have been provided with by Dr. Shahab and his team. As each of us know, we continue to strongly recommend against out-of-province travel at this time. We know that some people have traveled out of province recently, and some may have traveled out of province very recently, as we just had the Family Day holiday week. Our strong recommendation against out-of-province travel is due to the unnecessary risk that you put yourself in and your family in to exposure of COVID-19 variants in other areas of Canada. So on your return home, you also then will place, yes, additional family members, your friends, community members, and people in the province to the very same risk of exposure to these potential exposure to these COVID-19 variants. For anyone that has left the province, we are strongly recommending now that on your return that you get tested immediately on your return. We recommend you self-monitor and stay home if you're experiencing any symptoms at all. And then after 7 days, we recommend you go back and get tested again. With COVID cases still quite high and more cases of new variants popping up in other areas of the nation, we know no one wants to bring a different variant back to Saskatchewan and introduce it to their friends in their community. So please, if you have been outside of the province, on your return, go get tested. This tour here today was a great reminder that the best thing that we can do, we can all do together to protect ourselves and to protect others as we march back to a normal life in this province. The best thing that we can do is to get vaccinated, to plan to get vaccinated when it is your turn. So I would ask all Saskatchewan residents, when it is your turn, please make the decision to visit a vaccination clinic in this province and receive your vaccination so we can ultimately get back to the life that we knew previous COVID-19. If there's any questions, I'd be happy to take those now. So this is a recommendation. We won't force anyone to be tested, but if you have traveled recently in the last number of days or week or so, we would encourage you to get tested. Obviously, you can test positive for COVID up to about 14 days after you may have been in contact with it. You may be asymptomatic. And so if you have traveled outside of the province over the course of the last week, or returning to the province in the next number of days, we would ask that you get tested. You may have been in contact with a number of the variants that are present in other areas of Canada. We would ask you to get tested on your return. We would ask you to self-monitor for any symptoms, and we'd ask you again to get tested in about 7 days after your return. Just an extra level of precaution to to protect those people in our communities and across the province.
Why not follow the example set by other provinces, Manitoba, the Atlantic provinces, that if you leave the province, you are then quarantined for 2 weeks, and that's what I would think is even more protection.
And that may be a consideration at some point, not a consideration through our discussions with Dr. Shahab that we're at today. But what we are asking people to do, and what people have done so well, is to follow the recommendations that have been put forward. And right now, that recommendation is if you have chosen to travel outside of the province, and although Dr. Shahab and myself have recommended that you should not unless it's essential, but if you have chosen to travel outside of the province, we would ask on your return to take the extra care, take the extra level of protecting those around you, get tested immediately on your return, get tested 7 days after your return. It's just another layer of protection to ensure that we are doing what we can to keep these variants and to keep our COVID cases at as low a rate as possible. Ultimately, the path forward for all of us is to visit a centre just like this when it is our turn, receive our vaccination. That's ultimately the way that we're going to find our way through this COVID-19 global pandemic in our province of Saskatchewan.
Why not start with the 2 weeks? That again seems to have even more protection versus whether so why wasn't that part of the consideration?
This is the discussion that we had with Dr. Shahab on potentially people that may have left. The reason we've brought it up, or one of the parts of that discussion with respect to bringing this up now, is there may be some people that have chosen to leave the province. We just had the Family Day holiday that was in place, and some people may have chosen to leave the province with their family, and maybe not fully understanding that the risk is not just contracting COVID. Today, the risk has changed to some degree. The risk now is that you may not only contract COVID, you may contract one of the new variants of COVID, bring that back to your community, bring that back to the province, where we have had a very low level of any of the new variants, with just a couple of cases of the UK variant that were related directly to travel. So this is where the recommendation is here today. This is what we're asking Saskatchewan people to do today, is to increase the level of protection should they have traveled outside of the province, and to increase that level of protection on behalf of the people, their family members, their people that they may come in contact with their community, and ultimately the greater portion of the province.
Why the follow-up 7 days later? Like that seems to be
Doctor, would you like to weigh in on that?
Hi, so Tania Diener here. The 7 days can fit in with more or less the average time that it will take for someone to become infectious after being exposed. And as we know, some people can have COVID disease, although they're asymptomatic. So that would fit in with picking someone up who's asymptomatic, but who might be harboring the virus.
So is that recommendation being extended to people who haven't traveled? Because this is the first we've heard that you get tested once and then you should have follow up test 7 days later.
I was not involved in any of that decision making, so unfortunately,
I can speak maybe just at a high level, and really this is a question for Dr. Shahab himself, who's on a well-deserved day off today. And we have heard that when people are symptomatic, they would call the health line to book a test, and quite often they would be told to wait 48 hours, and if they're still symptomatic, then they should book their test at that point in time. So there is a period of time that folks have been asked to wait, either for the virus to manifest itself so that it can be detected, I presume, or ultimately it may be some other minor ailment that actually passes. We have in this province always had open testing. Not many other provinces, virtually most other provinces, have not had as open of of an opportunity to access testing as we have here in Saskatchewan. We do have the testing capacity, as we saw in the drive-through testing bays here today, to test more people than we are testing here today. I think this is a good way for us to utilize that testing capacity, as there may be some people and families that have left the province. We have the variants that are more common today than they were a few weeks ago. We most certainly want to use some of that testing capacity to protect Saskatchewan communities and Saskatchewan people and Saskatchewan families. And so through discussions with Dr. Shahab, he thought this was a prudent recommendation to those that may be returning or recently returned from out-of-province travel. I would say a few comments. The first would be my condolences to the family. This is a young fellow, a hero on the front lines of delivering health care in the province, not just through the COVID pandemic, but for some time now. And I truly would like the family to know that there are many thoughts and many prayers and many people that are thinking of their family across this province here today. This is also, a second point I would make is this is a reminder that although the large risk of severe outcomes when you contract COVID-19 are with our province's elderly, are with some of our province's immunocompromised folks, COVID-19 can impact anyone in a very, very negative way, up to including hospitalization and ultimately fatality, a fatality regardless of how old you are, regardless of whether you have underlying conditions. This is a reminder for all of us, until a time when we have the mass majority of Saskatchewan people visiting a site like this, receiving at least their first dose and ultimately their second dose, and being vaccinated against this virus. We need to keep our guard up, and we need to follow the protocols, the recommendations, and the guidance that Dr. Shahab and his team have provided us with. You look at us here today, we're all wearing masks. We're all standing, a fair amount apart. We have totally changed how we live from day to day to day, and that is to protect as many people as we can in this province. But today, unfortunately, we're reminded that this virus, the COVID-19 virus, can impact anyone in the most negative way you could think imaginable.
Today, in the release, it said that some people won't be receiving their second dose within the 42 days because of the shortage of the regular vaccine. There's some Health Care Regina that are under that umbrella. What's your comment on that? And would you have any concern that they have to go past that 42 days?
Yeah, Dr. Diener, if you wanted to comment on the days of call, I would leave that open to you if you chose to. But this is ultimately some of the consequence of an erratic supply of vaccines. And this, in fairness, this isn't just to Canada. However, we do seem to be having our fair share of reductions of our deliveries from where we anticipated those reductions would be. So as soon as we have vaccines available, those individuals are going to receive them as soon as we're able to supply them. You can see that we have the capacity in what we're looking at here today in our mass vaccination center, and in the people that are trained to deliver these vaccinations across the province. We do have the capacity, we just need the vaccines. We need a reliable supply of those vaccines. We've had a very challenging 2 months, two-thirds of our first quarter with respect to not receiving the numbers of vaccines that we had expected to receive. I am hopeful and I am quite confident that that is going to change in the weeks and months ahead. That's why we are here today, to show the capacity that Saskatchewan has in the ability to deliver many thousands of vaccines a day over the course of the next number of months, to ensure that as we do receive them, and I believe we will in the next number of months, we're going to be able to turn those vaccines around and provide them to Saskatchewan people in as quick a fashion as we are able. I don't know if you want to speak to the intervals between the shots, Doctor?
Right. Right. So I'll first address the 28 days and then 42, right? So depending on which vaccine you use, The second dose either will be given at 21 or 28 days. Stretching it to 42 days might sound very daunting. However, if you look at the UK, they provide their second dose of Moderna vaccine actually at 12 weeks. The CDC also did come out with a statement saying that if you receive your second dose later than recommended by the manufacturer, including past 42 days, it's acceptable and you don't have to repeat any doses, which fits in very well with other immunization series that we provide. For example, if you get a hepatitis B shot, it's supposed to be 0, 1, and 6 months. However, if you show up at 0, 4, and 3 years later, we're just going to give you that shot. The second in a series is usually more about the long-term protection. Then I just need to get the second question again. Right. So it all depends on what articles you read and how you read them.
And whether or not they're on Facebook.
Right. So if you look at efficacy within the first 14 days after the first immunization, you might actually pick up more people with the disease because they have not responded yet to the vaccine. So if you pick up any disease in the first 2 weeks after the first shot, it might mean that you've been exposed before that first needle. And so we shouldn't look at those numbers. If you look at efficacy after 14 days, so from 14 days up to the second shot for both Pfizer and Moderna, that's approved in Canada, they're in the low 90s. If you look at efficacy after the second dose for both of those, it's between 94 and 95%. So just don't read the articles that refer to efficacy in the first 14 days after dose 1.
How long time do you expect to spend here when you come to get a vaccination? Like, get the vaccination and just walk out and leave, or do I kind of stay around?
From the time that you come, from registration until you leave, it's about 30 minutes. The immunization itself takes about 8 to 10 minutes, but we do, with all vaccines, recommend that you wait for 15 minutes, and we have a waiting area for people. That's to ensure that you aren't having any immediate adverse reactions to the vaccine. Oh, my apologies. Laveena Tratch. I am the Regina Area Vaccine IHIC Chief. T-R-A-T-C-H.
Could you maybe just speak to the fact that this is where you run your influenza clinics as well?
Right. So we had the opportunity in the fall to actually, in preparation, knowing that the COVID vaccine was coming, to be able to set up a process and model and trial the flow and process through that. So we were able to, during the influenza campaign, be able to set up very similar, this is much expanded, but a very similar process and flow, which really allowed us to get to the point where when you come for your scheduled appointment, you are here for approximately 30 minutes. And that's from the very start until after your recovery period. So very similar, correct. Yes. Yeah.
Sheila,
Good afternoon.
Just say your name and
Yeah,
title.
for sure. Sheila Anderson. I could spell my last name. I think we all know how to spell Anderson, probably though. So yeah, we do. The SHA is offering a variety of the 3 types of clinics that the Premier mentioned. And so across the province, we're scaling up for many of those to, or all of those to be ready by March 15th, but there are many of them that are already already offering vaccines. So many of our mobile clinics, there is mass clinics or public health clinics that the Premier also mentioned. And we just haven't launched any of our official drive-through sites yet, but those are coming on and should be ready for the first vaccination as of March 15th.
180. Oh, 180, yeah. I can do that.
I'm sorry, pardon me?
I'll find a way.
Right. Yeah, absolutely. So we wanted to have in this particular site, we wanted to have the vaccine drive-through at the same location and right here in this location as the mass clinic as well too, just so, as the Premier said, we're able to shift our resources and our staff to meet the demand on a daily basis. So our actual COVID testing drive-through will be relocated to another location on the grounds here, and that will happen before March 15th as well too. Yeah, do you want to answer that one? Sure.
So for this particular location, we actually are going to begin using it on March the 1st to be able to start immunizing the phase 1 priority populations. So we are going to be working to immunize our 70-year-old and plus general populations from this location as vaccine becomes available. So. Our vaccine supplies are still going to be, our allocations are still going to be fairly limited at that time, and so we really have a process that is going to be built to be able to start reaching out to those particular individuals and start scheduling for them as we get a more stable supply. No, we will be reaching out to them. Correct.
I think if you go back to, and Minister Merriman may have a little bit to add just on the sites that we have, the numbers across the communities and how many communities, but many of them look like this, just different sizes. And as far as when, you know, we can go back to just it's simply dependent on the number of vaccines that we receive. The more vaccines we receive, the quicker we're able to ramp this particular site and others like it up to get those vaccines to Saskatchewan people. We most certainly are ready to deliver them. We're just waiting for ultimately them to arrive. And again, I would point back to we're just over 50,000 vaccines in the province. We need about 300,000 to find our way through our phase 1 priority group. So we have a long ways to go to get through phase 1. In saying that, we have you know, commitments to 6 million vaccines in the nation in the first quarter. I believe those to still be true, which means we're going to receive a significant amount of vaccines, likely from about 50,000 where we are today, up to about that 190,000, which would be our first quarter allotment in the next 4 to 5 weeks. So we are going to be busy in this province through the next 4 to 5 weeks, and then only to get busier as we get into March, and ultimately that's when a site like this will open and be ready to serve the people of Regina and area. But Paul, maybe just a little bit
Sure.
on we've seen the sites now, but how many communities, things of that nature?
We touched on this last week on the different locations of the sites, the mobile sites, the drive-through sites, and obviously the mass immunization clinics. We're going to have over 220 of these clinics across the province in 180 different communities to be able to make sure. And again, the question, we're going to be ready here as of March 1st, but our main focus right now is those 4 priority groups, which is residents and staff of long-term care, people over the age of 70, people over the age of 50 in the north, and those are actually, we're going out to them. And if this morning there was a bunch of mobile units that were ready to go, so for the long-term care people, we're not asking them to come down here if they're not able. We will come to you to be able to vaccinate you and your staff on location. So this will be open at that point in time, but it's going to be all dictated on the supply of vaccines. If our vaccine supply stays steady, we can start opening these up across the province, but we need more volume of vaccines.
Sheila?
Yeah, I'll touch on it. Maybe Sheila can get it. We've got allocated about 2,200 individuals that are for all of the vaccines clinics across the province. So those individuals will be working in shifts. This facility is going to be open for 16 hours a day, 7 days a week. So obviously we've got to have the much capacity in here, and it depends on what the volume is. We also have the flex that the other facility that will be set up in Regina if there's more people that are flowing to that facility and it's easier for them to get to, we can flex the staff over in that direction, the supplies. If people are coming here, we can scale up here as well. So we have lots of capacity built into this. We have our base capacity, and then we have our surge capacity, and then provincially we've got a larger capacity. And that's not even including when we engage the pharmacists and the family physicians. That's just SHA staff that's going to be involved in these clinics. So when we get into pharmacists, physicians, and other people that can vaccinate for us, the number is going to grow exponentially. I don't know if there's anything else. I think that covers it.
Why are you telling people that things like this could open in April when there isn't certainty that the vaccines
Isn't certainty around which, sorry?
that April there will be enough vaccine supply to actually move into phase 2 utilize?
We're most certainly ready. When the vaccines arrive, I think what is important here today is to show that the government of Saskatchewan, the Saskatchewan Health Authority, the health delivery apparatus that we have in this province is most certainly ready to deliver as many vaccines as we can receive to Saskatchewan people in very short order. We just need those vaccines now. As we said, this particular facility is planning to open on March the 1st. I had said earlier that we are expecting our vaccine deliveries to start to increase as we head through the last number of weeks of the first quarter, and then increase again from what we heard this morning from Major General Danny Fortin, where he said we're now up to 23 million doses coming in the second quarter. That brings us to about 8,000 doses a day. That may even go higher as we get through the next number of weeks. So we're ready. That's what we want to display here today. The Saskatchewan Health Authority is ready to provide these vaccines to Saskatchewan people, and we're very pleased and proud of the work that each of the individuals has done in setting up this facility and getting ready to deliver what is really a Herculean effort in providing the people of Saskatchewan with not just one dose of COVID vaccine, but 2 doses over the course of the next few months. And we also want to encourage and ask Saskatchewan people to consider getting vaccinated when it is their turn. That will be coming, and it will be coming quicker than maybe we think at times, as we've been through 11 long months now. But when it is your turn, we would ask you to consider visiting a site like this near or in your community and get vaccinated. That is a way for us to find our way through COVID-19, find our way back to our hockey arenas, to our safe classrooms, to find our way back to our safe workplaces, to seeing our family, and to some degree of normalcy.
Come to the last question.
Emergency staff tender for long-term care home. I was wondering if you could tell us what prompted that outbreak and also has been filling those gaps.
Go ahead, Paul.
Sure, thanks, Premier. This was done just in being proactive if there are any other massive outbreaks, that we have a team ready to be able to do this. Right now, we've been backfilling with SHA employees and pulling people. We've had reduction of services across the province to be able to backfill those positions, and we've also had SHA employees that have either self-isolated or been diagnosed with COVID. So we need that capacity to be freed up to be able to do this, to be able to do what we're here for today. So we don't want to tax those individuals with having to go into like a hotshot team to be able to help out in a long-term care facility. So that's why we're requesting that people, that we can put this team together to be able to free up those positions so we can allocate them into our vaccine, because as we've discussed, this is going to accelerate very quickly, and we need to have everybody ready. Well, absolutely, and the healthcare workers have done an outstanding job. Not only just day to day, but overall, a lot of them have been working very strenuous hours under very strenuous conditions. As you've seen, our hospitalization numbers are coming down, which relieves a little bit of pressure. Again, the biggest thing that's going to help our hospitalization is adhering to the public health guidelines and getting your vaccine when it is done. There are no magical people out there in the healthcare system. We've pulled on people within our post-secondary education. We're getting them engaged. We're getting retired people brought back into the system. This is an all hands on deck, and we're really pulling on everybody to be able to do this so we can, for the next 5 to 6 months until we get to September when the Prime Minister says everybody will have that. We need to have everybody ready to go. And we also just want to make sure that those people that have been working those hours get a little bit of a break before the next busiest time is going to come within the next few months.
It's proactive preparation.
Yep.
I think, in fairness, is what this is. Our healthcare workers have been incredibly adaptable over the last year now in the tasks that they have been required and been asked to do, and we thank each and every one of them for what they have done. But as to the previous question, we do need our resources in these vaccination centres, but we want to ensure that we are prepared should we have a challenge somewhere else in our healthcare system, like a long-term care centre. By this point in time, it would be our intent that all of our long-term care centres would ultimately have a very high degree of individuals that are vaccinated in those. That's why they have been in the phase 1 priority, and we're working our way through those long-term care centres now. That's likely where our mobile units went this morning when they left this facility. So the first plan would be that those resources would not be utilized. However, we want to ensure that we are being proactive and prepared should we need resources such as that at some point in time. The Saskatchewan Health Authority resources are being utilized in many different fashions that, yes, they are utilized for vaccination programs in other years. I don't know if ever to the level that we are asking them to do this year, and we are forever grateful for the effort that's being made.
Yep.
Is that the first Saskatchewan
That I've been made aware of, and again, I echo the Premier's comments and my condolences to the family. It seemed to have happened very, very quickly. I see that there's been a GoFundMe page set up for him and his family and his children, which I'd be very supportive of people helping them out, but it's the first one, yes, that I've been aware of.
Do you know if he's positive or
I don't have those details. There's a process that has to go through. I want to respect the family and make sure that, number one, that their interests are being looked after. But I don't know that information, and I would guess that we would probably not be revealing all of the details because it is a very tragic situation.
I guess this would apply more for the drive-through vaccination site, but are there safeguards in place to prevent line jumpers? Like someone, you don't need an appointment, right? So can someone just drive through and not be in that group?
Yeah, we've got a very extensive plan of where we can have everybody through. That'd be very difficult for people to jump the queue. Again, we're asking everybody to be patient, and again, this is extremely encouraging that we're having people that want to come in and get vaccinated. That's exactly what Premier and I have been talking about, and Dr. Shahab. So we ask everybody to be patient, to stay their place in line, and we'll get to you, and we're going to have markers out there telling you how long it's going to be from this point on, that it's going to be an hour wait or whatever, and give them the option of what they want to do at that point in time. But we will have people out patrolling, but I believe the Saskatchewan people will just wait their turn and be able to come in patiently.
Just on that, maybe Laveena, you had talked a little bit about the patient information flow for testing and how that will be transferred over to the vaccinations through the phone calls and such as vehicles come in. We just drive us through that flow of information, if you will.
For sure. Currently, we're utilizing a lot of the drive-through testing processes. We're utilizing that to build our processes for the drive-through immunization. They've been very successful across the country. And so as you come through, there's the opportunity that you will pre-register before you come in. So to the question about healthcare worker, or not healthcare worker, my apologies, to the sequencing and the line jumpers, your information is going to be confirmed prior to even getting in the building. So that will be done well in advance to ensure that those that are going to be immunized do fall within the category at that time that are eligible for immunization. So the processes are well set up in advance. You do pre-register externally before arriving into the site. We still have some work to do on some of the electronic documentation processes, but we're confident those are going to be in place by we get there, so that when you're here and you come in, it will be the same flow as when you come into this building here. So the registration you're not going to do it online or by phone call well in advance. You're going to do it while you're waiting in line to come into the building for immunization.
So what would stop someone in that area, let's say someone is going to bring their grandchildren and their children in their car with them to get vaccinated?
If they don't fall into the eligibility criteria, they can bring their children in with them. They won't be registered to be immunized at that time. They will be encouraged to follow up at a later date when they fall into that eligibility criteria.